Are you living with chronic pain or pain that just keeps on coming back? Have you tried multiple healthcare providers without a solution? Are you being offered drugs that make you feel sick and not really even solving your problem? In this video, you will start to understand the root causes of chronic pain to help you uncover it all. Whether you're dealing with back pain, arthritis, fibromyalgia, or any other type of chronic pain, this video is for you. Get ready to take control of your life and say goodbye to chronic pain for good. Before we get started talking about the 5 different sources that create pain, make sure you subscribe to our channel. Comment below on your own experiences or questions about managing your chronic pain. In our healthcare system, we tend to only treat symptoms. You have to understand where the pain is coming from before you can come up with a game plan. So let's get into all the sources of pain. When we look at the sources of pain, there's 5 major categories. And the first category, well, we'll talk about the first 3 because they're kind of clumped together a little bit. So we can talk about chemical pain, mechanical pain, and thermal pain. So thermal pain would be like burns and sunburns. So we're going to take that off the plate. And when we look at chemical pain and mechanical pain, they're very different and you treat them very different. So chemical pain would be like, I have an injury, you get inflammation, you have that that constant throbbing, aching pain. A lot of times you can't change your position to make it better or worse. It's just really irritated. And so the chemicals can treat the chemicals. So that's when drugs, injections, those kind of things can help with something like that. But here's the thing. You have to get into why is that inflamed? Why is that happening? Now, it could happen from a fall. That's totally fine. We've got to work on allowing our body to heal and get back to doing activity in a very slow, gradual way. But if we're not really sure what happened and we have this pain, we've got to have an understanding of what it is. So here's an example. If you had someone that had like a kidney infection, now they have that constant aching back pain that happens no matter what you do, you can't do anything about it. Now you can use, anti-inflammatory type medications. Those are chemicals. Chemicals can treat chemicals to help reduce the pain and make you feel better. But if you don't get to why that kidney is infected, you don't get that antibiotic, then you're just treating a symptom. You've got to get to understanding why it happens. And so that's why it's really important to get a good understanding of what it is. Now, mechanical pain is when you have it's the musculoskeletal body. It's how the joints move. It's how the muscles work together. It's all these things. Is there muscle tightness? Is there something that's not working? Is there something that's not moving? It's just how the musculoskeletal system works together. And you have to get to understanding what that is. That's the mechanical pain piece of it. And so you've got to get down to the mechanics and understanding the mechanics. And so if you go and throw drugs at a mechanical problem, it's not going to work because it's a mechanical problem. You've got to understand the mechanics of what's going on. And there's a lot of things that we have to look at with something that is mechanical. Mechanical pain is very much pattern-based. There you can, this happens and this happens. Like that, you'll see patterns with everything in the body. And those are very common when you see something that's very mechanical. Now, to understand, like, is this a mechanical problem or is this a chemical problem? Here's some questions that you can ask yourself. So like first one, can I change my position? Even if it's constant pain, can I change my position to make it better or worse? If you can change your position and make it better or worse, even, not fully better, but like I can get in this position and it makes it feel better for a period of time. Or I get in this position and it definitely makes it feel worse. That's mechanics. Like you have to address the mechanics. If you go throw drugs at that, it's not going to work. If your pain comes and goes, again, that's not something that is that constant aching pain. It's not chemical. So you will not need to have drugs or injections for cases like that. So those are some questions that you can kind of ask to kind of determine which direction do I really want to go. Now, if you're having chronic pain, guarantee you do not need drugs for something like that. Like it's rare. I mean, this is chronic pain. So when you have that inflammation from an injury that's very acute, if something is really bad, like you can have mechanical issues that like a meniscal tear that really needs to have surgery when you're younger, those are the mechanics. There are times when you need to have surgery, but as we get older and we're not really sure what we did to cause our pain, those kind of things, you get to someone that understands the mechanics, can kind of help put your body back together. So those are chemical pain, mechanical pain, and then thermal pains, burns, sunburns, take those off the table. So other two categories that you have to look at is autoimmune and emotional. So autoimmune is when you have someone that is, has a condition like fibromyalgia, or they have some weird symptoms, that is showing up. And when we go in to do an evaluation, if we can't change those symptoms at all, then we start asking other questions, because we should be able to change symptoms. We should be able to find something that is not quite right, whether the joint's not moving, a muscle that's tight, a muscle that's weak, compensation patterns, all those things. We should be able to see patterns with all these things. When you have something that's autoimmune, there's no patterns whatsoever. And so that kind of gives you the first sign of like when you're going through ruling out all these different things and all of a sudden like I'm not finding anything that makes changes, then we need to start asking questions like, are you bloated? Are you having constipation? Having issues with sleep? Are there certain foods that make you feel sick, even if they're healthy foods? And the people start saying yes, yes, yes. Fatigue, generalized fatigue, like something's wrong, but you just can't pinpoint it. These people tend to go to doctors, they'll get their blood work, it looks completely normal, and they're like, there's nothing wrong, and you're like, I know something's wrong. And so when people get like that, come to us, and we start noticing that, oh, this is not mechanical, this sounds more autoimmune, then we have to get to the source of the autoimmune, which basically is gut health. Most of our immune system resides in our gut, and we've got to make changes to help us balance that again. And so we have places that we send people to that will help people get their life back. Now it takes a while, it takes like 6 months, because these have been like, sometimes when I talk about autoimmune, I kind of think of like that stress fracture that you've stressed the body so much that's created this issue. Very similar with autoimmune. You've stressed the body in certain ways that's created an imbalance in the immune system, and we've got to get everything kind of back into balance. And there's things that you won't even know that are inflaming you that we've got to get a handle on what those are. And there's usually not just one, it's like multiple things. And when you get to someone that understands how to address that, your life completely changes. So again, we have places we send people to for autoimmune type conditions. And the last condition is emotional. That's when people have that emotional trauma. Now, a lot of times when people come in and we are able to give them things where they're able to control their pain, a lot of that goes away because it puts you in control. But there's times when we go in and we do an evaluation, we find the mechanical things that need to work on, they get better, but then they still come back in and say, well, I had pain. I'm like, okay, so tell me when you had pain. Well, every time I go to work, I notice that I have this. And I'm like, interesting, what's going on at work? And then they'll start going into all these things, and you just can see the stress that's happening to them. And I'm like, you've got to deal with this, because if you don't deal with that piece of it, your pain's going to continue to come. So like when I talk about all these different categories, if you miss the wrong category, you're just treating a symptom. You've got to understand all these different pieces. Otherwise, you're just continually going to be in pain. And you've got to get someone that understands this. So when people have that emotional trauma to them, we've got to address that. Now, there are times when we, again, can send people off and they can do some cognitive behavior therapy. We have a place that we send people to that specifically works with pain management, but from a cognitive behavior therapy. So a lot of times, other things that we'll hear from clients will be, if I go away on vacation, my pain goes away, but when I come back here, it starts all over again. I'm like, there's something here that you have to deal with. And so when, we talk about this with clients, we kind of tell them, like, remember, if there's song that you can hear a song and you haven't heard this song in a while, but that song that takes you right back to a moment in time in a movie that you saw 5 years ago. Like, you can literally see it with the song being on, like that part of the movie. Well, the same thing happens. There's things that happen that trigger your body to respond, and you've got to go back in time, not really in time, but you've got to go back to deal with that piece of it or figure that piece out. Otherwise, you're never going to get better. And so these are all things that we look at, and we have places for people to go to and send people to when when we understand what's going on, but we need to get to someone that really specializes in that. But these are all the different sources of pain that we deal with in our office. And you've got to understand all these pieces. Otherwise you're just treating a symptom, which is why so many people go to 7, 8, 9, 10 different healthcare providers before finding any kind of solution. By the time they get to us, because we look at everything, we look at the whole body, we're constantly questioning you, we're constantly assessing you every time you come in. Now, if you're looking to work with us or wanting to learn more about how we can help you, make sure you go into the description. We have a lot of different resources in there, as well as ways to help you be able to start the journey with us. We also have my book, and you have my book talks about all the different ways that we feel pain, and that link is in there, and it really does a deep dive into all these things, but it does it with stories of patients, so you can almost see yourself in those stories, go, oh my God, that sounds like me, that is me. And that's why I wrote the book, to kind of help you navigate the healthcare system a little bit better. So make sure you check that out as well. And again, subscribe to the channel. Comment below if you have any questions on anything, because we're here to help you, and we just love providing content for you.